everyone, and welcome back to Nurses Lecture Room YouTube channel. My name is Mercy Mary, popularly known as a nurse with the difference, and I make learning easy and accessible for students. Today we are going to be talking about asthma. What is asthma? What are the types of asthma? What are the causes of asthma? What is the pathophysiology, the nursing intervention, the nursing diagnosis, and also the medical management of asthma? By the end of this class, you will be able to answer all these questions correctly. But before we go into details, kindly click on the subscribe button, turn on the notification button so you don't miss out. Let's go there. Right, welcome back. Like I earlier said, today we're going to be talking about asthma. What is asthma? Asthma is a chronic reactive airway disorder that produces airway obstruction. There's an airway obstruction. You know, when we breathe in, it passes through the trachea, it passes through the bronchus before it finally gets to your lung. So there's an obstruction of that airway. There's an obstruction of your bronchus through which the air gets into the lung. That produces what? Airway obstruction. What causes this obstruction? That's why they say resulting from bronchial spasm. When we say bronchial spasm, it simply means involuntary contraction of the bronchus. When we say something is contracting, for example, this is the bronchus. When it contracts, it kind of becomes smaller. So air cannot pass through it. So there's what? Bronchial spasm, increased mucus secretion. For example, this is the bronchus again. When there's mucus in it, it will definitely going to reduce the air passing through it. Increased mucus secretion, mucosal edema. Edema. For example, there's an edema here, there's a swelling in the bronchus, definitely it's also going to impair air coming. If there's mucus, it's going to impair air coming. If there's inflammation, it's going to impair the air going to the lungs. That is why we say asthma is a chronic reactive airway disorder that produces what? Airway obstruction resulting from bronchial spasm, that's the involuntary contraction of the bronchus, increased mucus secretion, mucosal edema, and inflammation of the airway. Hope we understand this definition of asthma now. Then that takes us to the types of asthma. The first we have here, according to their causes, is extrinsic or atopic asthma. I've seen that a lot in objective questions. In extrinsic, what causes extrinsic asthma is as a result of external agents. For example, people react to pollen grains. So when they inhale that pollen grains, their systems, their lungs, their airway, they are sensitive to these pollen grains. It results in what? Asthma. Then intrinsic, as the name implies, inside our body. So this can be as a result of infection. It's no longer external agents. Now it's no longer external allergens. So that is why intrinsic, it is non-atopic. We have mixed asthma. It's as a result of both extrinsic and intrinsic factor. We have drug-induced, as the name implies, drug-induced. It's as a result of drug intake, drug that we take in. Maybe some people are reactive to it. Then we have exercise-induced. Some people, whenever they exercise themselves for a very, very long period of time, they tend to have this hypersensitivity that results in asthma. Then we have occupational asthma. As the name implies, the occupation some individual involved in, such as those working in industries that we have mice, we have a lot of things that are impairing the airway, that are obstructing the airway. But the common ones and the most popular one we have is, the most popular one we see is actually extrinsic, intrinsic, and mixed asthma. That takes us to the causes of asthma. The first one here we have is hereditary. Somebody in the lineage, somebody in the family can actually, like, when you know somebody in the family has it, there's a risk factor. There's you are being predisposed as an individual of going down with asthma. Then we have environmental stimuli, that's from extrinsic, your pollen grains. We have infection. We have emotional stress. We have fatigue. We have endocrine changes. We have emotional factors, exercise, and smoking. These are the causes / predisposing factor of asthma. Then that takes us to the pathophysiology of asthma proper. And the pathophysiology, we'll follow this line, the way we outline on the board. That's how we're going to remember it easily, and I bet it's going to be simple. Then the first thing is that there's inhalation of allergens or hypersensitive substance. We are using external as an example. There's inhalation. Somebody inhales that allergen. Somebody inhales that polygrains. He or she is hypersensitive to. So when there's inhalation, there's stimulation of mast cells. These mast cells in the mucosal membrane is being stimulated. And when these mast cells are stimulated, it leads to the release of the histamines, the bradykinins, and the prostaglandins. Take note of these two things. The mast cells are being released. And when these mast cells are being released, it leads to the release of histamine, bradykinin, and prostaglandins. These things here, what do? They cause that bronchospasm, which is involuntary contraction of the bronchus, and also excessive mucus secretion. So these three things, histamine, bradykinins, and prostaglandins that are being released, they cause what? Bronchospasm and excessive mucus secretion. When that happens, definitely the airway is going to be narrowed. There will be narrowing of the airway. That will now lead to difficulty with breathing. The person has wheezy respiration. The person has what? Wheezy respiration. Then there is irritation of the mucosal membrane as a result of all those processes. That mucosal membrane is being irritated. There will be excessive cough. You see the person coughing persistently, and definitely the mucus around the alveoli. There will not be mucus around the alveoli. We all know that the alveoli is a place where there's exchange of oxygen and carbon dioxide. That is the place where exchange takes place. So when there is now mucus in that alveoli, it will result in impairment of gas exchange. Gas will not be exchanged properly, and that now results in the signs and symptoms we see in asthma. The signs and symptoms of asthma include wheezy respiration. There's something I want you to take note of when it comes to the breathing of an asthmatic patient. They find it easy to breathe in, but find it difficult to breathe out. Then also we have cough, we have chest tightness, we have dyspnea, which is difficulty with breathing, we have hypoxia, we have restlessness, we have profuse sweating, and we have weak pulse. From these signs and symptoms, we can derive our nursing diagnosis. There is wheezy respiration, there is cough, there is dyspnea, there is hypoxia. That's to tell you there's going to be what? Difficulty with breathing. Remember in our signs and in our pathophysiology, we said that. Remember in our pathophysiology, we said that there is what? There's bronchospasm, which is the involuntary contraction of the bronchus. So the airway is what? Obstructed. So that's where we derive this first diagnosis from. We have ineffective airway clearance related to bronchospasm, evidenced by wheezy respiration. And also, because of this dyspnea, we have ineffective breathing pattern related to respiratory obstruction, evidenced by dyspnea. We can also have, from this profuse sweating, we can have impaired sleep pattern, disturbed sleep pattern. We can have anxiety, because no matter what a patient is suffering from, anxiety is like a very, very important. Most of our patients are anxious. They just get anxious easily. They're like, oh, what causes this? What causes this? Am I going to survive it? So it can be anxiety related to the cause or the outcome of the disease, evidenced by patients asking too many questions. When it comes to the management of asthma, the first thing you have to take note of is avoidance. What are you avoiding? You are avoiding areas that stimulate the attack. You are avoiding area that stimulates your body to produce those mast cells. So you have to avoid areas. If you are allergic to polygrains, you have to avoid that environment. If you are allergic to smoke, you have to avoid that environment. So avoidance is the number one, followed by medications, and also followed by oxygen. In terms of the medical management, in terms of the medication, the first one we have is the bronchodilators. As the name implies, bronchodilators. They help to dilate the bronchus. Remember when we are talking about asthma, we said there's involuntary contraction of the bronchus. So when you give a bronchodilator, it helps to dilate the bronchus so that air can pass through. An example of a bronchodilator is aminophylline. Then another drug is your expectorant. Remember also in our asthma at the beginning of the class, we said that there's secretion of mucus. This mucus can be sticky. So when you give expectorant, it helps to bring out those mucus easily with little or no stress. So examples of that expectorant is your acetylcysteine. Then another example or class of drugs we use is the corticosteroids, which is majorly for the inflammation, your immune response, e.g. your hydrocortisone. Then another example is the antibiotics. What do antibiotics do? They help to fight against bacterial infection. For example, your amoxicillin and your ampicillin. Then we have your adrenergic, which is your adrenaline and your non-adrenalines. They help in dilation. They help to dilate the muscles to ensure that they are okay. Then we have mast cells inhibitors. Remember when we were discussing the pathophysiology of asthma, we said that the allergies, they stimulate mast cell production, which then leads to the production of your bradykinin, your histamines, and all that. So these mast cells, they are being inhibited when you give mast cell inhibitors, and when they are inhibited, there will not be production of those bradykinin and prostaglandins and histamine. So that takes us to the nursing management proper. In terms of the nursing management, the first thing is what? Assessment. No matter what you do as a nurse, assessment is the number one thing you should take into consideration. You have to assess your patient properly to know the line of action to take on what you are doing. Then the other is position. Remember, the patient is having difficulty with breathing. So the best position to put this patient is in an upright position, a semi-fowler position, or a cardiac position. Then we have encourage relaxation technique and pause-sleep breathing. You encourage them, they should use the pause-sleep to breathe. Then with deep breathing and coughing exercise should also be encouraged. Minimize exposure. Then also use of inhaler. It's our duty to educate this patient to use their inhaler and take their prescribed medication. It is also our duty to educate them to avoid areas that stimulate this attack, or to avoid areas that stimulate this the body system to react. That takes us to the complication of asthma. We have status asthmaticus, we have heart failure, we have shock, and we have coma. Thank you very much for staying tuned. Thank you very much for watching our video. Don't forget to like, don't forget to drop your comments in the comment section, and don't forget to share with a friend if you got value. See you in our next video.